My name is Alyssa Hobson. I am a current second-year medical student at the University of Kansas Medical Center. I was also one of the executive directors for our student-run free clinic. I, along with a few of my co-directors, put together a diversity and inclusion training module for our free clinic student volunteers and collected some data that we'll go through here. As an introduction, our student-run free clinic serves a patient population with an average demographic makeup that differs significantly from the average of our medical student volunteers. So our research goal is to determine student comfort in working with diverse populations, assess for any gaps in the school curriculum regarding cultural competency, and see how these factors change following a diversity training module. For our methods, we had a module of clinical scenarios following the training for our first-year medical students. Students were able to work through these scenarios in small groups with a trained leader, and then each scenario was reviewed by the training lead with the educational goals explained. They focused on treating patients of diverse racial backgrounds, utilizing interpreters during sensitive exams, transgender inclusive sexual care, and utilizing our community resources, particularly with trauma-informed care. At the end, an anonymous survey was sent out via RedCap addressing our study questions. If you'd like to know more about our discussion points, I've included them in an appendix at the end of this presentation. For our results, I will go through these more specifically, but here is a little bit of a summary. First, we had students rate their confidence in working with diverse patient populations before and after the training. And as you can see, there was a statistically significant increase in post-training confidence. The next question we had for them was pre and post-training knowledge of working with diverse patient populations, also a statistically significant increase in their knowledge. We also ranked the usefulness by scenario and asked students specific questions regarding each scenario. For the first one, treating patients of diverse racial backgrounds, the majority of students said that this was not a useful scenario, and we tried to examine why based on the feedback, and we learned that it was a little bit redundant with some lecture. However, our small group leaders found that many questions being asked were not indicative of full understanding, so we think we would like to include this example in future trainings, but would just perhaps do more application-based scenarios and less overall discussion time based on the feedback we received. The second scenario, utilizing interpreters during sensitive exams, this one had majority positive, with over 30 of the 41 students saying it was useful. And we think this is likely because our clinic has a large percentage of patients that require a visit to be conducted with an interpreter. And this is something many medical students don't have experience with before. So we think we would include this one as is. Scenario 3, transgender inclusive sexual care. Our clinic provides hormone replacement therapy for transgender patients, many of whom seek care at our general nights for other concerns. So this is something important for our student volunteers to know, and most of the feedback stated that they found it useful. However, we did have some negative written feedback along with a few no responses, and I've included a comment of some of the negative feedback below just as a representative example. Scenario 4, utilizing community resources with trauma-informed care. This was held at the very end of our training, at which point we were a little bit over time. And so we went through this one more briefly, and I think that could have led to some of the mixed responses. We have noted that in the future, we might need to hold this as a separate training, as it is an important scenario and did take more time than probably would work at the end of our general training. We also compared usefulness by the instruction type, as this was the first time we've held this training. And we had students rank small group versus large group productivity and found that students thought the large group was significantly more productive. And you can see our analysis there. We think this might have been due to differences in the training leads. So in the future, we might shorten small group time and also make clear discussion points for the leaders. And then another thing we found interesting is that many students did find this addressed a current gap in M1 curriculum. I think that can be something to just consider for other free clinics who maybe do not yet have diversity trainings, or just a thing to consider for curriculum at medical schools in general. A few discussion points: only 41 of our over 100 students attending the training were able to complete this survey. And we think based on the written feedback, students who filled it out had either strongly positive or negative opinions and might not be representative of most of their class. And then also a lot of the feedback was about the length and placement of the training, which is a little bit less helpful for restructuring, but we do know to have this as a separate training and warn students about the time. And just to conclude, based on survey responses, a need has been identified for student-run free clinics to provide training on working with diverse populations separate from the medical school curriculum to address the gap in knowledge. The results of the study could also be extrapolated to other free clinics at schools with similar curriculum or to lead to changes in existing diversity trainings. Thank you for listening. I have my acknowledgements and appendices here.